childhood cancer. Of course, one of the scariest words any parent can hear is that word cancer, but notice some of the stats that are out there. We have gone from a survival rate of 58% back in the 70s to now 83% today. And joining me right now is Dr. Avery Mixon with Erlanger, the appropriate title, Assistant Professor of Pediatrics at the Children's Hospital at Erlanger. Told you I would get it.
It's a mouthful.
Those numbers are great to hear, and outside of obviously an improvement in medicine, what are some other ways and reasons that we are now seeing an increase in beating cancer, especially in children?
Sure. So the bulk of the improvement has been in not necessarily new drugs per se, as much as it has been in using those drugs in a smarter way, tweaking the protocols here and there to not only improve therapy but to reduce some of the side effects as well. There's been a huge improvement in supportive care, making sure that we are appropriately treating infections and monitoring for those type of things. And it's been a slow, gradual improvement that a lot of these clinical trials have helped us to achieve.
Now, one of the most common cancers that's out there in children is leukemia, and reading some of the stats and studies from that, going from a less than 10% survival rate in the 60s to now over 90%. So we're seeing some major changes there, major advancements there as well. But when you think of childhood cancer and, you know, in this community, how prevalent is it? Is that increasing or is it decreasing?
Well, I think we have seen historically the numbers here in Chattanooga have slowly been increasing, but they've been increasing concordant with the population growth in the city. So I don't really think that the overall numbers are improving radically. I think it's been a slow, steady increase like we would expect.
Now, when it comes to care, and we're thinking with childhood cancer, you know, Erlanger is a place to go. It is a, you know, there's research, there's obviously plenty of care there. Talk about maybe some of the care that is available here in the Scenic City.
Sure. Well, we are members of the Children's Oncology Group here in Chattanooga, and that is really a nationwide and a worldwide group of children's hospitals that band together to do research. And so we're not only researching the why do people have it, but we're also working together to find cures. And so we are able to offer you the same therapy here that you would have, let's say, if you were in Knoxville or Atlanta or Chicago or LA. We all do therapy similarly. So one of the benefits of what we're able to offer at Erlanger is the same therapy, the same state-of-the-art therapy that you would get anywhere.
Now, when it comes to therapy, sometimes that is after a child has beat cancer and has gone through the rigorous treatment of chemotherapy. But are there side effects that we are seeing, or something that we may need to be informed about now?
Well, sure. All of the medicines that we use have pretty significant side effects. And the one thing that we tell people is the day that their cancer is cured, we don't turn them loose and wish them good luck, have a good life. We have a late effects clinic. It's a multidisciplinary team of different types of physicians, a physical therapist, for example. And what we do is we monitor for side effects based on what medicines people have received and try to tailor a follow-up plan for someone that we're addressing the needs that they have individually. To try and nip any side effects in the bud if that's possible early on.
Now, I know there are a lot of parents that are watching, grandparents that are watching, and probably one of the biggest questions that they have is how to prevent cancer, even if that is possible.
That is a subject of many studies that we are doing, worldwide, and we're trying to better understand that. We would say, make sure your child sees their pediatrician like they're supposed to, but the percentage of children, in the global population that actually get cancer is still very low.
Right.
So as for now, we really don't have any great preventative measures.
Now, but of course, when it comes to things like secondhand smoke and sun exposure, and that does affect our children, maybe not so much as a child, but those are things that still we need to remember even as our children grow into adults.
Absolutely. Those type of things can cause long-term kind of DNA damage, which really sets you up for cancer. And so, if you can avoid some of those risks, then that's great.
All right, we certainly do appreciate you coming on here because the overall theme is that we are continuing to beat more and more of childhood cancer. All right, folks, for more information, you're welcome to contact the great folks and the great researchers like Dr. Mixon, who is the Assistant Professor of Pediatrics. The phone number there is 778-7289. Of course, for just information about Erlanger and the great things that they do, you can always call them at 778-LINK or look them up on the web at erlanger.org. Doctor, thank you for what you're doing and the research that you're doing as well.
Thank you for bringing attention to it.
All right, folks, we're going to say a big congratulations out to